Hello, everybody, and welcome back to the Patient First podcast. And being part of this presentation, I'm so excited, as I always am, that you are here. And we have a great guest today. We have Lynda Ricketson, who is president and CEO of Dental Lifeline Network. Before joining Dental Lifeline Network in February of 2022, she served as vice president of philanthropic services at prominent organizations and contributed to many fundraising efforts, earning a certified fundraising executive designation, which I'd love you to tell me about that because I don't know what that is. Ms. Ricketson is actively engaged in the Colorado Planned Giving Roundtable, showcasing her commitment to the field. Thank you, Lynda, so much for being here.
Thank you very much for having me. I can tell you a little bit about the CFRE. It's basically a designation, and a national and international designation that just shows you have great credibility in ethics in fundraising, and that you've succeeded in some fundraising goals. But it's a fully proctored exam. It's pretty interesting. But
neat.
So
that's the first time I've ever heard fully proctored exam and interesting in the same sentence. So that's interesting in and of itself. Well, could you tell us a little bit about Dental Lifeline Network and kind of what you guys do there?
Sure, I'm happy to. So Dental Lifeline Network was founded in Colorado in 1974 by a dental student named Dr. Larry Coffey. His sister Barbie had been living with disabilities, and he recognized the difficulty that she had in obtaining care. And this led him to found Dental Lifeline Network. It all began with an educational hygiene program for people living with disabilities and their caregivers. That program, which is called the Campaign of Concern, is still in operation in Colorado today. And then in 1985, the organization launched its flagship program, which is called Donated Dental Services, or DDS. The organization started in Colorado and slowly spread across the country, and now we have a presence in every state. We serve patients who are elderly, living with disabilities, permanent disabilities that can be mental or physical, medically compromised patients, such as those needing life-saving care like dialysis or chemotherapy, and they can't access that treatment because they can't get dental clearance, and also veterans who have no other access to care. And the way that it works, patients are seen in the office of a volunteer general dentist who derives the treatment plan and decides whether or not to take on the case. The vast majority of our patients require additional support from specialists and labs, and our staff triage the patients and they coordinate the case from beginning to end, which often can take as long as 6 months to a year. We make it very, very easy for dentists to give back. Since 1985, we've served over 170,000 patients with a total donated dental treatment value of almost $550 million.
It's great. And we met for the first time not that long ago at a dental meeting, but I've been part of Dental Lifeline Network and the DDS program for well over a decade. But now I don't see patients regularly. And so it's kind of serendipitous that we were at the same event. And man, I really love the fact that you do the triaging so that, it can be difficult to give back to your practice when you have patients. Like, who do you select, right, as the patients you give back to? And it's, you do such a great job of helping that. So how does Dental Lifeline Network reach people that are in need of dental services?
Well, people who are in pain are typically pretty motivated to find care. So they typically find us on their own through searching online. They can also get a paper application if that's what they need to do. And, we also partner with a lot of social workers, case managers, and others within social service sector to ensure that those in need can find the care that they so desperately need.
Yeah. And I think the majority of patients that I saw were referred by social workers, and which was really interesting because, like I said, you don't really get that insight in your dental practice database to typically find those patients in need. It's nice to have people reaching out to services that can triage for you. So how often, I know from my experience, but how often are dentists who volunteer for DLN called upon to provide services?
We ask volunteers to take 1 or 2 patients per year. As you know, having been in the volunteer seat yourself, the cases are fairly extensive. Would you mind talking a little bit about your experience when you were volunteering for the program?
Yes, no, absolutely. And for me, I think we saw one patient a quarter. However, that's
Wow.
what we signed up for. I don't think we didn't see that many because I think, we would see everybody that you would refer over. I do think that, the people were very well pre-screened, incredibly grateful. I think the patients that came in were very grateful for the treatment that they received and, and open to doing, whatever treatment plan we had. 100% of the time, we were able to find specialists and laboratories who were willing to donate their time to not, this wasn't reaching out to some laboratory that we don't typically use. We would just ask our laboratory that we have
Right.
a DLN patient, and you guys coordinated with that laboratory. And I think 100% of the time, we're able to get that patient the specialty and laboratory care that they needed, which is great.
That's amazing. Thank you for all that you did for Dental Lifeline Network. That's amazing. We get a lot of thank you letters from patients who are just so grateful, and their lives are just literally transformed from having received dental care. They could smile again. They can eat apples and carrots. Those are the most common foods that people seem to miss when they're not able to chew properly. So we really appreciate you and all the other volunteer dentists that make this program a reality.
Well, I think most dentists go into dentistry, and most dental professionals, frankly, go into dentistry to help people, right? And in the day-to-day experience of treatment planning and case acceptance and selling dentistry, it is nice. I mean, I think most dentists want to give back. And I have had negative experiences where I've tried to give back by doing pro bono treatment on patients of record. It just doesn't, you don't know if you're selecting the people that actually need the help or not.
Mhm.
And it's nice to be able to sort of partner with a company that helps do that so that you can focus on taking care of your patient's needs, doing the day-to-day operations of your practice, but then also work with a charitable organization that helps you give back in a way that doesn't disrupt your practice. Not
Mhm.
necessarily disrupted from a workflow perspective, but just from the perspective of, obviously you can always do pro bono care for your patients if you so choose, but it can be challenging. It can be challenging to decide who and how, as much, particularly for the larger cases like we do with DLN.
Mhm.
Doing a filling or maybe a couple spots of scaling or planning is one thing, but for people that need comprehensive needs, where you're going to be doing care coordination with a specialist in a laboratory, coordinating that on your own is going to be difficult, if not problematic. And
Right.
and I do think I think that frankly, it helps your practice too. How would you say that volunteering for DLN is good for practices?
Oh, there are so many reasons. Thank you for asking the question. Employees really want to work for companies that give back, and there are positive benefits for a company that does give back. I think that one of the things that we're hearing pretty constantly now is that workforce shortages are really impacting dental practices. Dentists are working harder. They're having a hard time finding hygienists and other office staff to support them. So having a good corporate social responsibility platform and really showing that you're a good citizen of the community, I think is really helpful. Employees who participate in volunteerism have generally higher morale, increased happiness. And as we all know, happy employees are more productive, and they tend to work harder and take real pride in their company. So that's some of the intangible benefits. But volunteering for Dental Lifeline Network, as you know, goes well beyond the dentist. It includes the office staff, all the way from the office manager to the hygienist, the dental assistant. And we hear from dentists a lot about how transformative the experience was for their office as a collective. So that's one of the really great things. Um, Going back to the staffing shortage, we found an article that Forbes did back in 2022 that showed that companies see a 52% lower turnover rate among newer employees when they participate in purpose programs such as Dental Lifeline Network's donated dental services. And then also the people that are entering the workforce or early career in the workforce are the millennial generation. They're socially conscious. They want to engage in causes that help other people, and they want to provide charitable care. So it really can help a dental practice to differentiate themselves from others if they're participating in those programs. And I think it's also really good from the client perspective. Paying patients have a lot of choices, as you well know, and they feel better about going to a dentist that serves the community. We provide plaques to our volunteer dentists, so it's easier for them to let their patients know that they're giving back to their community.
Yeah, we had our DLN plaque with all the years that I can't
Yeah,
remember if we how but it was a lot of years that
that's
we filled
great.
up. And to your point earlier, I don't know the percentage of patients that send thank you letters back to the practice, but if it wasn't 100%, it was close. And so, I mean, you know, it just helps the team morale to give back, right? And I think
Yeah.
we can give back in many different ways, but but giving back with large cases for people that are being referred by social workers who have, not just dental needs, but these people are a
Mhm.
lot of the people that we treated were getting sort of their life back on track, and it's just
Yeah.
nice to be part of that story of helping them kind of shake the etch a sketch of problems, so to speak. It's the way that I look at it, right? And
Yeah.
get back on, maybe not the most compassionate way of saying it, but there, some people, like, they just have some beyond their teeth, they have other things going on in their life, and they're getting their oral needs met is a big part of them getting their life back on track, right?
Yeah, I mean, it helps them to be able to get gainful employment again. And you just see people when they start out, they're sort of downtrodden, their shoulders are dipped over, and they're just not feeling very good about themselves, and they're in pain. And watching them go through the process and then exiting the dental office on that final visit when they're, like you said, put totally back together. It's remarkable. It's really the stories that keep us going. One of the ones that we heard recently that really affected me personally was that it was a father who had lost many of his teeth. And so some of his grandchildren were a little bit afraid of him because he didn't look like other people's grandparents, perhaps. And afterwards, it just restored his relationship with those grandkids. And that's just hard to quantify.
Yeah, it's hard to even imagine if your grandkids were scared of you, what the impact that would have on your life, right? Well, and DLN, I didn't realize that it was started by somebody in dental school, which I didn't do much in dental school other than I did survive, and I did get my degree. Other than that, there wasn't a lot going on, and other than eating junk food and trying to stay out of trouble. But
I don't know. I
but
think graduating and getting your degree is pretty remarkable. So
well, I didn't start an entire organization that is celebrating 50 years of operation. I mean, that's just uh, phenomenal. The 50-year history of helping patients. So, what are the things that we can expect from DLN this year now that you're entering your 50th year?
yeah, we are just starting on our second year of a strategic plan. You know, we really recognize that the world of dentistry is changing and pretty rapidly. There's the infusion of dental service organizations, dental practice organizations, group dentistry, however you want to refer to it. So, after I started, so in March of 2022, we embarked on a strategic plan, which was approved in November, and then we began the implementation of that plan in February of last year. And so the three key goals are really to increase awareness of Dental Lifeline Network, promote volunteerism amongst the group dentistry practices and younger dentists who are entering into the world of dentistry, and also improving and streamlining our internal infrastructure, and key to all nonprofits, raise more revenue to support our programs, which provide critical care to people in need.
That's great. Well, it's neat to have your new sort of mission, new vision based on 50 years and the changing dental environment. I agree with you completely. We are in a liminal moment in time in dentistry. I call it dentistry 3.0. We're shifting to what I call connected dentistry. And you hit on one of the bullet points there, which is connected practices, DSOs, the group practice. Also remote care, which is, I think DLN will probably could play in that space of remote care. All connected systems, interoperability, which is what we at Tooth Apps are solving that problem. Our systems need to connect for us to elevate our care, to unlock innovation. I think that's going to be sort of what unlocks this next phase of dentistry. And then also another aspect of dentistry 3.0, this next phase of care, where DLN can play a role, which we kind of alluded to before, which is the medical connection to overall health. The dental connection to overall health. How does DLN bridge that gap between overall health and dental health?
Yeah, we have some educational materials that we share with dental offices. I think it's pretty remarkable that in general, people don't really understand the connection between overall health and dental health and the impact that can have on heart health, pregnancy, birth complications, pneumonia, diabetes, HIV, prostate cancer, osteoporosis, Alzheimer's disease. I can just go on and on. And so part of it is just providing that education and making sure that people are aware of that. We have resources on our website that really underscore the importance of oral health.
Yeah, I mean, I think that the connection of medicine and dentistry is so, to say it gently, is so there's so much progress to be made there, right? It's so archaic that we don't even know. I mean, we can see the correlations, but we don't know the causation. We know that 1/3 of people that have periodontal disease have diabetes. Does one cause the other? We don't know because we don't connect our systems, right? A simple one, 1/3 of dental emergencies end up in the ER. Why is that happening? Is it because dentists have on their voicemail to call 911 and we don't connect these systems, so we can't solve the issue? Educating patients about their dental health being part of their overall health and connecting these pieces together, we're going to be able, I believe, to unlock so much information to help people in a lot of different ways and solve the problems. Like, why are the correlations between obesity and oral health? And today we can't answer those questions until we connect our systems and make those connections. So very much appreciate what DLN is doing in that area for sure.
Yeah. I feel really hopeful about that integration. I once upon a time was a program officer at a community foundation and did anything that was like mental health related or dental health related. And, it occurs to you in those moments that there are certain elements of the body that don't really belong in the body. Like teeth don't seem to belong in the body, eyes don't seem to belong in the body, and mental health didn't seem to be part of the body. But I think that mental health has really done a better job of getting integrated into the overall health. When I go to my primary care doctor now, I get asked about my mental health. They're not asking me if I go to the dentist. They're not asking me about the eye doctor. So I think that there's some real hope for dentistry and the medical world to be better integrated.
Yeah, I agree. And I like connection versus integration for dentistry because I believe that when
There you
people
go.
are talking about integration and there's this movement to have dentistry become a subset of medicine, and I think that helps nobody except for
Right.
maybe medical insurance companies, which I don't think they need any help. They seem to be doing all right. So I think we as an industry, when we're talking about the dental medical connection, correlation, let's use the verbiage. I think, and this isn't, I'm not reacting to exactly what you said. I'm reacting to a trend in dentistry to incorporate medical systems, which was only going to lead to one thing, and that is hurting everybody in the industry. So let's maintain our autonomy from medicine while also connecting our systems. Right? We don't need to become a subset of medicine. We need to connect to
Right.
them in a meaningful way, and I think there's ways to do that and maintaining what's really working in dentistry. Because let's face it, there's a lot of things that in medicine that we do not want to infect the dental industry, right? We don't want dentistry necessarily to be paid for the way that medicine is. Maybe yes, maybe no. I think it depends on what happens. But we certainly don't want to have everything we do be dictated by somebody who's not a clinician, right? Which I
Right.
think happens on the medical side. So sorry for a little diatribe there,
No,
but
no,
it's something I feel passionate about.
Yeah, no, that's a really good point. I think that going back to the example of mental health, I mean, they're not providing mental health in the doctor's office. They're just making sure that you're getting a referral to an appropriate provider. And from my understanding, a vast difference between the training that you received in dental school compared to somebody who's getting their MD.
Absolutely. And by the way, same thing with with overall health. It's not connection of dentistry to your primary physician. It's dental, oral health to overall health. So mental health is part of that, right? We should be communicating with everybody that, all of these, there should be a care team looking at the patient and each individually having that piece that they're focused on, but connecting with them. Because obviously I've seen many patients, likely some from DLN, who their mental health is absolutely directly affecting their oral health. And it's very difficult for us to address their oral health until they get their mental health taken care of. And there's, several examples of that.
Yeah. I mean, it can be really hard to find the motivation to get to the dental office if you're just completely demoralized and depressed. It can be really incapacitating.
Yeah. I just talked to somebody this last week who had recovered from addiction. And we were talking about how, using substances that directly affect your central nervous system, even if you have recovered for several years, it rewires your central nervous system. So that you need to be aware of that when you're a dentist, and just something as simple as anesthetic works differently in somebody who's rewired their central nervous system than somebody that hasn't, right? It's being aware of a patient's mental history, mental health history, even if they've fully recovered, directly addresses the care that we give. Simple example, we don't have to treat people's mental health issues, but being aware will help us provide better care.
Yeah, that's terrific.
Well, how can dental professionals get involved with DLN? If they're listening, they're thinking, boy, this is I'd love to give back. I'd love to work with DLN to help select 1 or 2 patients a year that we can help out. How should they get involved?
Yeah, that's great. Going back to something that you said earlier about dentists really getting involved in dentistry in the first place because they want to help people. We started a new campaign called Why I Dental, and it extends beyond dentists to hygienists and even to me. I'm in a dental world. And so we have a website, whyidental.org, and it makes it super simple to sign up.
Great. Well, I urge those of you that are listening that are clinicians that want to get involved, go to whydental.org. Lynda, it's been a pleasure having you on the podcast, and thank you so much for all you do.
Well, thank you for all you do. We really appreciate your helping us with this podcast.
Absolutely.